this role, having initially started my career as a care assistant in supported living services back in 1987. I loved the job. I was very proud to do that job and make a difference. But through the widening access scheme, I was able to go back to university and train as a learning disability nurse. That really increased my awareness of inequality, stigma, the discrimination, and even the hate crime that people with learning disabilities experienced. And it really got my determination going to try and address some of those inequalities. I then commenced my first CAMS role as a complex needs practitioner and then a senior practitioner within the Learning Disability Complex Needs Service. I was able to lead on the development of a nurse-led learning disability service that has dramatically improved outcomes for children and young people. And I was awarded the RCNI Learning Disability Nursing Award in 2018 for that work. Only a few months ago, I commenced a part-time secondment to NHS England. I'm part of the Quality Improvement Task Force, looking at children and young people's mental health, learning disability and autism inpatient services. I have completed additional training and qualifications. I undertook the Community Specialist Practitioner qualification in learning disabilities. I've also undertaken a range of training specifically in terms of clinical skills. I'm trained to undertake ADOS assessments and the CHAPAS assessment, which really helps clinicians understand the mental health concerns of children and young people with learning disabilities. There is no typical day with regards to my role. As the clinical lead, I lead the CAMS learning disability team in delivering specialist community-based interventions to address mental health and behavioural needs of children and young people with learning disabilities. So that might be being out and about, visiting families at home, visiting children in school. It might be advising parents in developing positive behaviour support plans or offering one-to-one therapeutic interventions for children who are able to engage in that work. Multi-agency working is key, so there'll be lots of close liaison with other professionals, really in order to provide a very coordinated approach for those families. A key aspect of the role that really is embedded into everything we do is co-production, consulting and working alongside our colleagues, be that children and young people, parents or local agencies and other organisations. Professionally, I bring to the role a lot of experience and knowledge. Although I qualified relatively late in life, I'm conscious I've had 33 years of experience working within the NHS with people with learning disabilities. Personally, I think I'm empathetic and respectful. I have a very strong value base, and even after all this time in the role, I still have a lot of energy and enthusiasm for the work that I do. The thing I enjoy most about my role is that it's an absolute privilege I have to be in a leadership role and yet still work directly with children and young people and their families. Receiving feedback from colleagues with regard to the leadership that you provide to the team is really rewarding. The way I work and the way I practice is really in line with the type of leadership that I'm offering to them as a team. I'd like to make people aware of the opportunities that are available within children's services for learning disability nurses. I don't think people always know the extensive roles within children's services that learning disability nurses are involved in. There are quite a lot of us working with children, and it's the opportunity to make a difference at an early stage really and offer that early intervention, and I would recommend that to everybody.